Hello and welcome to Lupus Impact Foundation, where I aspire to educate, inspire, support and give hope to those living with lupus, their families and communities, transforming adversity into advocacy. Please note that the site content is provided for information purposes only, and I share my experiences with lupus as a registered nurse and an individual living with lupus and rheumatoid arthritis. So this information must not substitute professional medical advice, treatment or diagnosis that you are currently on or have been advised to follow. Today's subject is very contemporary, very relatable. Today I'm going to talk to you about understanding biologics and post-treatment management. Many of you know recently I've been speaking a lot about biologics, that I'm currently receiving biologics for my kidneys and the treatment of lupus. And that is something that was really difficult for me to access due to medical aid issues. And finally, I've been able to get a hold of the biologics and be treated. So let's discuss biologics today. I know there's a lot of lupus patients that are receiving biologics as well. I see a lot of questions coming through about how do you manage post-infusion after you've received your rituximab or whatever biologic you're receiving. We know it is an immunosuppressant, so it suppresses the immune system. You become prone to infections, and therefore you need to be very guarded, very careful about how you take care of yourself post-infusion. I've received my infusion last week. I was hospitalized, and I'm going back next week for my second infusion. So it is an infusion that I receive every 6 months, and that depends on your blood work. It depends on how much protein you have in your urine, and then doctor will have to liaise with the medical aid to try and access the drug for you. Today, let's shed some light on a groundbreaking advancement in the treatment of lupus: biologics. Lupus, as many of you know, is a chronic autoimmune disease that can affect various parts of the body, causing inflammation and tissue damage. Traditionally, managing lupus has been challenging, often requiring a combination of medications to control symptoms and prevent flare-ups. However, the emergence of biologic therapies has transformed the landscape of lupus treatment, offering new hope for us patients living with lupus. So what are biologics, you may be asking? Biologics are a class of medication derived from living organisms such as cells or tissues. Unlike traditional drugs that are chemically synthesized, biologics are produced through biotechnological processes. In the context of lupus treatment, biologics target specific components of the immune system that are involved in disease process, thereby helping to reduce inflammation and control symptoms. The biologic that I am receiving is called rituximab, Ristova, and it is an infusion that I receive. It usually runs for an entire day. Sometimes it requires hospitalization, depending on any concerns that doctor may have, if she needs to do CT scans. Like I was admitted now and I had a CT scan of my abdomen done. I had the physiotherapist who saw me. I also had the endocrinologist involved in my care, which I'll shed some light on a little bit later. And so it was quite an intensive treatment this time. Let's focus our attention to the management of individuals with lupus after the treatment of biologics. While biologics offer significant benefits, it is essential to recognize that managing lupus doesn't end with the administration of the medication. Post-treatment plays a crucial role in ensuring the long-term well-being of patients. First and foremost, regular monitoring is essential to assess the response to treatment and detect any potential side effects or complications. This may involve regular checkups with healthcare providers, as well as laboratory tests to evaluate disease activity and monitor for any abnormalities. Additionally, lifestyle modifications are key in managing lupus after the treatment of biologics. This includes maintaining a healthy diet, getting regular exercises that you can manage, managing stress levels, avoiding triggers that can worsen the symptoms or precipitate flare-ups. Education about the disease and self-management strategies is critical. Empowering patients to take an active role in their care and make informed decisions about their health is crucial. Furthermore, it is important to address any comorbidities or complications that may arise in individuals with lupus. As I have mentioned, the endocrinologist was involved in my care this time. It is because prior to receiving my infusion, I had the flu for 2 weeks. I was really ill. I was not getting better, and eventually I had to go onto a course of cortisone. Whilst receiving the biologics, we also receive cortisone to minimize the side effects, any anaphylaxis, any adverse reactions. Therefore, we need to be given a pre-med of cortisone as well. So that is very necessary. So we receive a pre-med of Precautions, which is IV paracetamol for pain and for fever. We also receive Phenergan, which is also for any allergic reactions that we might experience, and the Solucotif, as I've mentioned. So we get that prior to receiving the rituximab infusion. This may involve coordinating care with other healthcare specialists, such as rheumatologists, nephrologists to look after the kidneys, dermatologists to look after the skin, psychologists to look after your mind, your mental health, and the multidisciplinary team like your physiotherapists and your dietitians who get involved in your care to ensure comprehensive management of the disease and its associated manifestations. In conclusion, biologics represent a significant advancement in the treatment of lupus, offering new hope for patients grappling with this challenging autoimmune disease that is incurable, but manageable. However, effective management doesn't end with the administration of the drug, of the medication. It requires a holistic approach that encompasses regular monitoring, lifestyle modifications, and comprehensive care. By working together, healthcare providers and patients can optimize outcomes and improve the quality of life for individuals that are living with lupus like us. Some of the things I do post-treatment, I know some of you have been asking, is that I limit my exposure to the outside world. I try to stay at home, especially for the first few days, because after the infusion, you tend to become very exhausted. You experience a lot of weakness, a lot of tiredness, fatigue that is unexplainable. No amount of rest compensates for the tiredness that you experience, the fatigue that you experience, and you just have to rest. You don't have a choice. There's nothing you can push yourself to do except just slow down and just, take some me time and just do you the way you can. You cannot do anything more. I know I had an appointment this morning that I had to cancel because I felt very sick last night. I didn't have a good night. So you see, you can never plan ahead because you never know how you're going to feel the next day. So try to cancel if you must, even though it may seem important, it may seem like, but you are more important. There's no way you can do life if you're not well. Try to wash your hands often, sanitize your hands, wear a mask if you have to go outside. Like sometimes I have to get to the pharmacy because they get quite confused with my medication. So I must wear a mask when I go out, and limit my contact with sick people, your contact with sick people. If you have sick people in the home, you would say, how do we navigate that? It's simple. Practice safe hygiene precautions. Isolate yourself if possible. I know it's not always possible, but if it is, try to do that, especially after receiving your infusion. You know your immune system is really weak. You are susceptible to a whole host of infections and bugs that are going around. Get plenty of rest, hydration, fresh water. Keep your mind busy with productive things. Don't overanalyze this period of resting, because it is very necessary. I know when I have to rest, I feel like I haven't accomplished anything. I feel like I haven't done anything for the day. It was such a wasted day. But then I quickly remind myself that I am not a healthy person. I am a person who's living with lupus. Unfortunately, that is the way things are, and this is my new norm. Sometimes it will require that I just have to leave everything aside and just rest my body and my mind and my soul. And I hope that you do the same as well. Please remember to visit my website on www.lupusimpactfoundation.com. If you want to order my book, you may order the book titled The Show Must Go On my website as well. Thank you for those who are still looking out for the book. Many of you have been hearing about the book, ordering your copy, reading, and giving me feedback as well. I'm glad to know that the show is going on in your life. Please like, subscribe, comment, and share this video, because together we can make lupus known. I often say it is not an individual effort. It is not something I can achieve on my own. We as a community need to make people aware of what lupus is. If you know somebody who has lupus, who's struggling with lupus, share this video with them. I know it's going to make a difference to them. Thank you so much for listening, guys. Thank you for always sending messages through. Thank you for all the love, the support during my hospitalizations. I really appreciate every single one of you. I also want to say a big thank you to Mediclinic Durbanville, who takes such good care of me when I'm there for my infusions. Really, it's really amazing how you guys just go the extra mile and just make things so simple. I was taken such good care of by the nurses that I was able to mostly sleep through my infusion, which is very uncommon for me, and that is because I felt safe with you. So I want to say thank you. Remember to follow us on our Facebook page, TikTok, Instagram, LinkedIn, and on our website. Remember www.lupusimpactfoundation.com. Send through your suggestions for content on our email. And until next time, guys, take care of yourselves. Remember to maintain a healthy mind, body, and soul. Thank you for listening. Love you. Bye.